I'm Laura Wingate. I'm the Senior Vice President of Education, Support, and Advocacy for the Crohn's and Colitis Foundation. And I'm really thrilled tonight to be welcoming Erin Testerman-Mitra, who is joining me today. She is a wound, ostomy, and continence nurse from New York-Presbyterian Columbia Medical Center in New York, and is a volunteer for the United Ostomy Association of America. Erin, thank you for joining me so much this evening. One of our other speakers, Dr. Stefan Hollenbar, was unable to join at this time, so we're going to move forward with our program this evening with Erin. And I also want to thank the United Ostomy Association of America for partnering with the foundation on the content for tonight's program. You'll find the resources to support the information we're providing you tonight on both the foundation and the UOAA websites. In addition, I want to thank our sponsors, Janssen and Takeda, for their support of our COVID-19 programs and resources. And tonight's program, I want to give a big thank you to 11 Health Technologies for supporting tonight's Facebook Live program. As always, I want to make sure that everybody on the program tonight understands that the information we're providing during tonight's chat is meant for educational purposes only. It should not replace any advice you receive from your gastroenterologist, your wound ostomy nurse, or your surgeon. So if you have questions about your specific care, please reach out to your healthcare provider and team. So without any further ado, Erin, let's just jump into the questions. All right, so my first question, Erin, and I know a lot of the people in our IBD community have this question: does having an ostomy or ileostomy or Jpouch negatively impact your immune system?
No. So what I'll say is having the ostomy, ileostomy, or Jpouch truly is just the ability for your body to heal from the areas that are the most affected. And honestly, people have a better quality of life, generally speaking, once they're able to kind of heal from the injury that they suffered. And the surgery itself doesn't change the person they are, but just gives them that chance to heal and kind of actually they eat foods they weren't able to eat before and get stronger and have more of a quality of life.
And so are ostomy patients at risk of greater infection? And can you speak to the rate? Is it higher in someone who recently had an ostomy surgery or resection in recent months or weeks, or opposed to somebody who's had it for, a year or more?
So every time a person does have surgery, of course, their body is under a certain inflammation and it's kind of like a healing after the initial surgery. So they're going to be fatigued. They're going to have like a 2-step forward, a 3-step back kind of day. And we always try to remind people that, it's okay to be exhausted. It's okay to have a day where you just can't do your walk to the mailbox or your mile walk, or, just to rest and to just be encouraged that, you did the surgery because your other methods were not effective. So you went the route of medications, you went the route of doing everything you could with your diet and your lifestyle to be healthy. And then you had your surgery because that was told the best thing for your body. So the risk of infection doesn't so much go up as much as you have to heal. People need a little more time. They need a little bit more caregiving, and to receive that caregiving and be gentle on themselves, because there is an inherent stress with surgery. And having an ostomy, of course, is a life change. So they need that support, whether it be with medical or with their family and friends. And it's so important to have a social support group and just be open to the idea that your body may look different on the outside, but you are healing and you made a choice to have surgery because it's the best choice for you, whether it's a temporary ostomy or more maybe a longer term ostomy, or when you went through the Jpouch surgery. So it's a time of adaptation. You're doing your food journaling, you're doing a lot of just support and rest.
I think it's really reassuring in your comments that the risk of infection isn't greater, but the need to allow yourself to rest and heal and take the time post-surgery is reassuring to the community. Um, for someone with a Jpouch, are there any additional precautions they should be taking during the SARS-CoV-2 COVID-19 pandemic?
I think a big thing is just the safety of like if you're going to work or if you're able to work from home. I am in New York, so for everybody who's tuning in that's not in New York, I know your lives are a little bit different depending on where you live. So in New York City, we're definitely having a lot of cases. So my hospital has a lot of cases. So we're not expected to be able to go to the grocery store and if, as easily as we were 2 months ago. So, you know, we are wearing our mask, we are, you know, sheltering in place. So you're not having the community that you once had or the ability to get like the freshest foods either you bought or your family member bought for you. So I think that the thing about having a Jpouch, just you gotta stay hydrated. You have to have that good nutrition in your body. You still have to be in touch with your providers because there might be certain medications that you are required to take. And, you know, just getting the follow-up that you need to get with your providers can be a little bit more challenging with the technical difficulties of not being able to actually be present. But the support systems are still in place. The doctor's offices are still open. Your nursing care and your caregivers at home are still available. So even if you know, it's a new Jpouch or it's a new ostomy, you still have, you know, the same teaching that you need. It's just sometimes it's a little bit more struggle because you don't have the same connection or the same in-person discussion that you would have had there not been the COVID-19 pandemic.
Mm-hmm. Yes, good point. You touched on something in your answer that I wanted to follow up on. If I'm experiencing dehydration or other GI symptoms, how could I tell if it's my IBD or related to potentially a COVID-19? Is there any way for me to make that distinction?
Yes. So what you talk about is like your symptoms, right? So COVID-19, if you go to the CDC guidelines, they have a list of like symptoms. They're constantly updating them. But for the COVID-19, what they say is that fever, cough, shortness of breath, body aches, chills, headaches, just even now loss of smell. So just things that just really kind of take you off your feet that you weren't expecting. And the idea is that it's different because IBD, people who've gone through IBD know what their bodies are like. They understand their bodies very well, more than I could ever explain to somebody because they come and tell me how they feel and what they know about their own bodies. So there are days where you're dehydrated or you're not feeling well and your body's starting to experience something. And the best thing to do is just contact your provider because you know yourself. Your provider knows you. And then working on medications, hydration, diet. And then if you are like afraid that like, hey, like my family member also has similar symptoms, or I was recently exposed, whether it be at work or something, that's something that you really need to contact your provider about just to kind of get a test if you can. And then honestly, the best thing to do if you're a little unsure is to self-isolate. There are a lot of, you have to wear your mask and then kind of step away from your family members because the idea of the spreading, you know, through droplets is very important to prevent. So whether if you're a little confused in the beginning, it's better to wear a mask and kind of isolate, watch your symptoms, contact a provider, and then go through those channels to see what's the next step for you.
Yeah, and those are all really important points that I know both the United Ostomy Association of America and the Foundation are reiterating in all of our resources for COVID-19. So I think those are really important points for the community to remember. So I have a few questions on IBD surgeries. And what if I'm having severe pain due to an abscess or an obstruction? Would I have surgery now, or should I be waiting to have it later? What guidance can you provide our community?
So I understand that in some communities, things are considered elective procedures versus urgent and necessary procedures. So of course, if you're having severe pain or you're having obstruction, those are such a severe thing that you can't cope. So unfortunately, a lot of times you are going into the ER for that. And I know that's a very scary time. So before, going to the ER, if you can contact your provider, whether it be a surgical provider or your gastro, just to be like, hey, is there any way that I can avoid the ER, get a direct admission, which would be most safe for you? Of course, elective surgeries are more things that are considered like, is it more of a risk for you to come to the hospital? So that's where they kind of draw the line between necessary versus elective. But anytime you're in severe pain, you are having fevers, you're so ill that you can't get up out of your bed, basically, those are necessary surgeries. And why I hope that no one has to go through that. Of course, you need to get the care that you deserve.
Really important point, and to contact your doctor and go through that discussion with them so you can be assessed and make that critical decision if it needs to be done now with an obstruction or abscess, or if it can wait till later. So that's really good advice. Do you have you been using telemedicine, and is that what you would recommend for our IBD community to engage with right now?
Yes, so I think honestly at this point it's safest for most people to do a telemedicine visit. While technology is a challenge, and then you also don't get that caregiver to provider experience where you get to really feel that person out. It is like generally safe, more safe for the person who is going through these symptoms. And if you know your provider, you know how they care about you, and even if they're not able to convey that person to person, you're just safer in your own home to do these virtual visits at this time. Of course, when we can be back to being person to person, I hope that everybody gets that kind of support they deserve. And of course, like you have your surgical team, you have your gastro team, and whatever medications you're taking, just be very honest about how you're feeling and really journal if you can journal, because you get the most accurate description of your day.
So, Erin, you've had your telemedicine appointment. You've decided that it is a surgery that you need to have right now. What precautions should someone be taking if they're having surgery, in the next day or two, that is considered something they have to do? What precautions should they be taking?
So honestly, a lot of people are being like self-isolating at home, and that's very difficult. I know that we miss human connection, but you are staying safe from the outside world, and you're staying safe from people who like maybe shedding the virus and don't have symptoms. So stay self-isolating if you can. Of course, if you're in your family community and they're not showing symptoms and everyone's healthy, you're able to be in your family setting. But try to avoid like the outside world, the grocery stores, if you can, right before surgery. In our hospital in York-Presbyterian, they are doing that nose swab 24 hours prior to surgery, because it's for your safety. So it's for your safety because they want to make sure that your body's the best it can be, even if you are like having awful symptoms that are driving you to have surgery. At least you have like your body ready for the surgery, and then also to give you the right care. So even if like you do have symptoms, if someone does have COVID, it's not automatically they don't get to have surgery. It's just they're getting all the treatment they need. That everyone is ready to give them the proper care.
Right. That's an important point. That they should expect to have a COVID test before going in and having their surgery. Well, what would family be able to visit post-surgery? Should people be planning to have their family member contact them virtually while they're in the hospital? What advice can you give there?
So in New York City, unfortunately, family is not allowed to visit during this time. So for my folks who had surgery during this COVID-19 pandemic, they see my face and they kind of have to just, use me as like a resounding board so they can talk. And then we do very happy to call the family, do video visits with their phone. So make sure that, you get, everybody kind of on board. You get this virtual like empowerment, whether you do FaceTime or WhatsApp or any type of Zooming. Your family is present with you, even if they physically can't be by your bedside. And to have surgery during this time, of course, is not anybody's goal. But if it's what your body needs, then your surgeon's going to do what they need to do. Your family is going to be there to support you, and your caregivers at the bedside are going to be there to support you.
Very important point. Are there any additional precautions those with an ostomy should take beyond regular hand washing and hygiene when changing their appliance? What advice can you give?
Hygiene is truly the only thing you really have to do if you do have an ostomy. We always tell people they can travel anywhere in the world as long as they can drink the water, brush the teeth. So in this time, there is discussion about if people do have symptoms and they are diagnosed with COVID-19, that they want to separate the bathroom. So if someone has COVID-19, then they would need to clean the bathroom after they use it or something. So you would just dispose of your waste properly, and like remove it. And then your caregivers who are going to be there to support you would also be able to, mindfully dispose of things without causing any trouble in the home. So generally speaking, hygiene is all like hand washing and hygiene is truly the best thing. If a person is diagnosed with COVID-19, then your hospital will have certain precautions and protocols to keep you and your family safe.
That's good advice, and good to know that regular hygiene is the most important point here. What should patients do if they need to see a wound nurse for an issue with their stoma or a leaky appliance right now?
We're going to keep doing telehealth as basic. I'm sure in certain parts of the country, you're able to see the person and they'll be able to be hands-on with you. They might wear a mask, but they're still right with you. And I'm so happy for the fact that some places are able to have hands-on care. But say you need help with at my hospital. So what we try to do first is on the phone. If we can, we'll video chat. And if you do need to come in, like we still do like take people in because we're not going to let people like be in pain or trouble. So we'll try the non-person to person methods at first, but if you need help, you're always going to get help. And that doesn't automatically mean you're going to go to the ER to get that help, but to have a good connection, to keep your provider and your wound ostomy nurse up to date, important. A lot of places may not have email or may not have a direct number for a WCN, but they will have like the clinic get a hold of them. So just try to foster that relationship and just know who your allies are in your care.
And on a similar note, do you recommend going into the hospital or a doctor's office to have your stoma looked at, or instead having a nurse come to your house?
So where I am, most of the time we have a follow-up appointment. I get to see everybody come back in. If they have staples, we remove them. Nowadays, a lot of times the surgeons are trying to do less staples because that way a person doesn't have to come back in. So home care is super effective for the fact that it is a continuation of care. So a lot of times a person is not in the hospital very long. So you don't get a lot of teaching as much as you really want, but the home care is supposed to kind of enforce like certain things that you learned and just give you the confidence at home that, hey, you can do this. It's something new. No one just climbed into a car and just started driving right away, even if they've been riding, in the next seat. But it's just a little bit of training and getting used to just this new change. But it's all doable. It's all able to be assisted through visiting nurses or with your home-based nurse. But if you can't see that person you can talk to them. And hopefully everyone has somebody that they feel comfortable speaking to and that is able to get back to them in a reasonable fashion so they don't feel like they're on their own.
Right, right. And if you do have a nurse come to your house to help out, what should we expect? Are they arriving in protective gear? Will they change into protective gear upon arrival? What insights can you share?
So my understanding is that with protective equipment, there's some standard protective equipment that someone might wear a head bonnet. They might wear an N95, and I had to, wear that to more than one home. But generally speaking, the shield around that N95 mask might be changed between person to person. When it comes to shoes, hopefully, like most people, they have shoe bonnets, so it'd be nice for them not to bring something into your home. And then gloves, of course, they're going to change their gloves frequently. So no one should be wearing the same gloves the entire time.
It's just reassuring to hear what the expectations are so that when someone's coming into your home, you know what to expect and you have a visual of what that nurse visit will be like. I know this is a common question we have in our IBD Help Center. Are there shortages of supplies and should patients be stocking up, Erin?
So when my colleague and I were starting to realize that, oh my goodness, we should really try to get our patients like aware and get their supplies like 3 months in advance. But we kept getting email after email that everyone has like enough supplies. We haven't had a shortage yet. Basically every company we've ever spoken to, whether they have like a sampling program, reached out to us saying that, we're not in a shortage. We have supplies. We're not at a point that we should be worried. But I do understand there's delays. There's quite a few delays, whether it be with shipping or the fact that some supplies are back ordered. So it is, if you, of course, for safety's sake and just comfort, you might want to try to get like a 3-month allotment versus like your 1-month allotment, especially if your insurance is it takes a while to get back to you because most people are working from home. So whether it be the insurance providing the authorization or the medical supply company that actually responds back to all the scripts and the faxes and the emails that they get, there could be some delays. So I understand that, well, you can't stress out about the fact that people are taking longer than they generally used to. It's best just to know that, you have an X amount of supplies. If we can get more supplies, great, just because it gives you comfort. But you have control. Your bodies, you can get a good seal, and we're going to get through this, and then we're not going to be in a shortage where you don't have any help at all because your clinics or your hospital does have supplies, so you're not going to be on your own.
I think that's a really important point, and also about planning ahead. And I know all of the advocacy organizations like the Friends of Colitis Foundation and United Ostomy and others have been working to make sure that our insurers and our relief programs are including stipulations so that people don't have barriers to getting access to their medications or supplies. So that's something we'll continue to work on so that the 3-month supplies aren't a barrier to our patient community and getting access to the resources they need during this pandemic time.
Yeah, and honestly, it's been amazing what I've seen come out of both the Friends of Colitis Foundation and the UOAA about options for people, links and numbers so they can contact. And most places that produce supplies are able to do a sampling program. So they've not given me pushback at all when I've asked them to help out because there has been a delay in insurance authorization.
Very important point. Well, I want to thank our wound ostomy nurse, Erin Testerman-Mitra, for joining us this evening. And I also am truly grateful for the United Ostomy Association of America for collaborating with the foundation on the content for tonight's program. I also want to remind everyone, if you have additional questions, you can visit both the Crohn's and Colitis Foundation and the UOA website. And you may also contact the IBD Help Center. We're available at 888-694-8872, extension 8. We're also reachable via email at info@crohnscolidusfoundation.org. And you can chat live with the specialists, where the specialists are available Monday, Tuesday, you can chat live on Monday, Tuesday, and Thursday from 9 a.m. to 5 p.m. And the IBD Help Center is open every day of the week, Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. So please visit both the United Ostomy Association of America as well as the Foundation if you have additional questions. I'd also like to once again thank Janssen and Takeda for supporting our COVID-19 resources. And I'd also like to recognize the sponsor of tonight's program, our Facebook Live program, 11 Health Technologies. I also want to thank you all for joining us this evening. And I'm really excited and I hope you will join us on Saturday, June 20th, for our first virtual Take Steps walk. You can learn more about our virtual walk by visiting cctakesteps.org, and I look forward to seeing you all there. I'll be walking virtually with all of you. And if you've enjoyed this session and learned valuable information, I do hope that you'll share this recording with those, your friends, your family, and others with IBD. It will be posted on the website tomorrow. And we want to continue to serve the IBD community with programs like this. And your support of the foundation is really critical to our education support programs. And it's really important now more than ever. People really need the resources that we're providing during these challenging times. And many not-for-profits like us are struggling. So if you are able to contribute and support programs like the one this evening, we would appreciate your support and taking the time to donate to us during this difficult time. Thank you, everybody, for joining us this evening. I hope you found the information we've shared tonight valuable, and have a good night, everyone.